We've all been told that routine health checkups are essential, especially as we age. But what if I told you that some medical tests might actually do more harm than good, particularly once you're over the age of 70? Yes, that's right. In today's video, I'm going to talk about 5 health screenings and checkups that experts say you may want to avoid after 70. These tests, while useful earlier in life, could lead to unnecessary treatments, anxiety, false alarms, and even physical harm when you're older. Think about this. Modern medicine has made incredible advancements, and early detection has saved countless lives, no doubt about that. But what many people don't realize is that the benefits of certain tests decrease with age. While the risks increase, imagine going through a painful procedure, or even surgery, because of a test result, only to later find out that the issue might never have caused you harm in the first place. Sadly, this happens more often than you think, especially in people over 70 who are more vulnerable to complications. The truth is, after a certain age, the focus of healthcare should shift. It's no longer just about detecting every possible illness. It's about preserving your quality of life, avoiding unnecessary stress, and making sure that every test and treatment is truly worth it. In this video, we'll break down 5 common checkups that you or your loved ones may be getting too late in life, and what the medical research actually says about them. We're going to separate fact from fear and give you a clear understanding of when testing helps and when it might hurt. Whether you're a senior yourself or you care for someone who is, this information can help you make smarter, safer, and more confident healthcare decisions, so make sure to watch until the end, because the last test we'll discuss is one that's still widely recommended. But experts are now seriously questioning it for older adults. Don't forget to like this video if you care about smart health choices, subscribe for more science-backed health content, and share it with someone over 70 who needs to hear this. Now, let's move to scene 2. Why over-testing can be more dangerous than helpful in older age. So why exactly can routine checkups become risky after 70? The answer lies in something called over-testing, and it's a growing concern in modern medicine, you see. As we age, our bodies naturally change. Some conditions grow slowly and may never affect your quality of life, especially if you're already dealing with other health issues. But many standard tests are designed to catch even the tiniest problems. Even if those problems don't need treatment, that's where the danger begins. A test might find something small, like a tiny tumor or a mild irregularity, and suddenly, you're caught in a spiral of anxiety, follow-up scans, biopsies, or even surgery. In younger patients, that might make sense. But after 70, the risks of these procedures often outweigh the benefits. Overtesting can lead to what doctors call overdiagnosis, detecting a condition that will never cause symptoms or shorten your life. Yet, once it's found, many people feel pressured to treat it. Treatments themselves, whether it's surgery, radiation, or aggressive medication, can be especially hard on older adults. Recovery is slower. Side effects are stronger. The emotional toll? Huge. And let's not forget the financial costs. Extra tests, procedures, and prescriptions add up fast, often draining retirement savings for minimal, if any, health improvement. This is why many geriatric specialists now focus on individualized care. They ask, will this test truly improve my patient's life? Will it prevent serious harm or just create more worry? Coming up next, we'll look at 5 specific checkups that are commonly overused after age 70 and what you should consider before agreeing to them. Now let's talk about the 5 common health checkups that older adults, especially those over 70, may want to reconsider. These tests aren't inherently bad, but when done routinely in older age, they can lead to unnecessary treatments, stress, or even harm. 1. Colonoscopies are useful for detecting colon cancer early. But after 70, especially if you've had previous normal results, the risks may outweigh the benefits. Complications like bleeding or colon perforation increase with age. Most guidelines recommend stopping regular colonoscopies by 75 or even earlier if you're in poor health. To mammograms, while mammograms help detect breast cancer, they can also lead to overdiagnosis in older women catching very slow-growing cancers that may never spread or cause harm. This can result in painful biopsies or unnecessary treatments. If you're over 70 and have no family history or symptoms, talk to your doctor about whether it's still needed. 3 PSA test prostate cancer for men. The PSA blood test can detect prostate cancer, but it often finds slow-growing tumors that are harmless. After 70, the risk of false positives increases, leading to invasive biopsies or surgeries that carry serious side effects, like incontinence or erectile dysfunction. Most experts now advise against routine PSA testing at this age point for whole body scans. These are often marketed as preventive health checks, but they can detect harmless abnormalities that lead to a chain reaction of tests, anxiety, and unnecessary procedures. Most medical professionals do not recommend full body scans unless you have a specific symptom or diagnosis. 5. Pap smears. Cervical cancer screening. If you've had a history of normal results, most guidelines say women over 65 no longer need pap smears. Continuing them past 70 can lead to false positives, unnecessary worry, and invasive follow-up procedures. Remember, the goal isn't to avoid health care, it's to get the right kind of care. Coming up next, we'll explore what older adults should actually focus on to stay healthy, strong, and independent. So, if some tests become risky or less useful after 70, what should you focus on instead? Great question. Because good health in your 70s and beyond isn't about endless screening, it's about maintaining function, independence and peace of mind. Here are the smart, science-backed priorities every senior should focus on. Chronic disease management conditions. Like high blood pressure, diabetes, and heart disease are more common after 70, and managing them well is crucial. Regular checkups for these issues, along with medication reviews, can prevent complications and hospital visits. Fall prevention. Falls are one of the leading causes of injury in older adults. Simple changes like balance exercises, strength training, and home safety upgrades can dramatically reduce your risk. It's one of the best investments you can make in your long-term health. Mental and cognitive health. Staying mentally sharp is just as important as physical health. Engage in activities that stimulate the brain, puzzles, reading, learning new skills, or even social interaction. Depression and isolation are real concerns after retirement. So make staying connected a priority. Nutrition and physical activity. What you eat and how you move can either speed up aging or slow it down. A diet rich in whole foods, lean protein, and fiber, paired with gentle, regular movement, can keep you feeling young, energized, and strong. Meaningful doctor visits. Shift your doctor visits away from chasing tests and toward discussing quality of life. Are you sleeping well? Are you in pain? Are your medications still necessary? A good geriatric doctor focuses on what matters most, not just numbers on a chart. The key is this: personalized care, not one-size-fits-all testing. After 70, every medical decision should support your well-being, not add fear, confusion, or risk. And up next, in our final scene, we'll wrap it all up with a practical message: how to stay informed, confident, and in control of your healthcare journey. So let's bring it all together. Just because a test is available doesn't mean it's always necessary, especially after 70. Medicine isn't one size fits. It's on an older age. It's not just about living longer. It's about living better. The 5 checkups we covered today: colonoscopies, mammograms, PSA tests, full body scans, and pap smears may still be useful in certain situations. But for many seniors, they carry risks that outweigh the benefits. What matters most is personalized care. A healthcare plan that takes into account your age, your medical history, your goals, and most importantly, your quality of life. You deserve to feel confident when making decisions about your health. That means asking the right questions, like, will this test change how we manage my health? What are the risks if I skip it? Is there a safer, simpler way to monitor this? Don't be afraid to have open conversations with your doctor. If they don't, explain the risks clearly, or if they push tests that don't feel right, it's okay to get a second opinion. Remember, choosing not to test isn't giving up, it's being smart. It's cautious and informed. That's what real healthcare is all about. If this video helped you feel more in control of your health, please give it a like, hit subscribe, turn on notifications so you never miss content that matters. Leave a comment below. Which test surprised you the most? Or share your experience with a test you now regret. Your story might help someone else make a better decision. And most importantly, take care of yourself, not just through tests, but through lifestyle, love, and peace of mind. Thank you for watching, and here's to smarter, safer aging.